4 medications, billions of dollars in sales, and one question that millions of people are asking right now: which one is actually the best for you? Here's the thing. Most people have no idea that 2 of these medications are essentially the same drug with different names, and the other 2? They work through an entirely different mechanism that might make them significantly more effective. In Dr. Rocio Salas-Whalen's groundbreaking book Weightless, she breaks down exactly how these medications work with your metabolism. Today, I'm giving you the complete comparison so you can have an informed conversation with your doctor. Let's start with something that confuses almost everyone. Ozempic and Wegovy contain the exact same active ingredient. It's called Semaglutide. The difference? Ozempic is FDA approved for type 2 diabetes. Wegovy is FDA approved for type 2 diabetes. Wegovy is FDA approved specifically for weight management. Same drug, different approvals, different maximum doses. Now here's where it gets interesting. Mounjaro and Zepbound also contain the same active ingredient, which is Tirzepatide. And just like the other pair, Mounjaro is approved for diabetes, while Zepbound is approved for weight loss. So really, we're not comparing 4 completely different medications. We're comparing 2 different drugs, each sold under 2 different brand names for 2 different purposes. Understanding this is crucial because it affects everything from insurance coverage to your out-of-pocket costs. These medications represent a genuine revolution in how we approach metabolic health. But choosing between them requires understanding what makes each one unique. If you're finding this helpful already, do me a favor and hit that like button. It helps more people discover this information, and honestly, everyone deserves to understand their options. While you're at it, subscribe to the channel so you don't miss the deep dive videos coming next. Let's break down the semaglutide medications first. That's Ozempic and Wegovy. Semaglutide is what's called a GLP-1 receptor agonist. In simple terms, it mimics a hormone your body naturally produces when you eat. This hormone tells your brain you're full, slows down digestion, and helps regulate blood sugar. The problem is, this natural hormone only lasts a few minutes in your body. Semaglutide sticks around for about a week, which is why you only need 1 injection per week. Now stay with me here, because what I'm about to explain changes everything about how you understand these medications. Ozempic comes in doses up to 2 milligrams per week. Wegovy goes up to 2.4 milligrams. That might not sound like a big difference, but studies show that higher doses typically lead to greater weight loss. In clinical trials, people taking Wegovy at the maximum dose lost an average of 15 to 17% of their body weight over about 16 months. That's significant. For someone weighing 200 pounds, we're talking about losing 30 to 34 pounds on average. Some people lose more, some less. Individual results vary based on factors like diet, exercise, genetics, and starting weight. But here's what most videos won't tell you. There's a reason why many doctors are now preferring the Tirzepatide medications, and it has everything to do with a second hormone most people have never heard of. Now let's talk about Tirzepatide. That's Mounjaro and Zepbound. Here's the key difference. While semaglutide targets just one hormone receptor, Tirzepatide targets 2. It activates both GLP-1 receptors and GIP receptors. GIP stands for glucose-dependent insulinotropic polypeptide. I know that's a mouthful, but what matters is what it does. GIP is another gut hormone that works alongside GLP-1. When you activate both of these pathways simultaneously, you get a more powerful effect on appetite, blood sugar regulation, and fat metabolism. This dual-action approach more closely mimics your body's natural response to food, and the clinical results? They've genuinely surprised researchers. I'll give you the exact numbers in a moment, and they're eye-opening. Mounjaro comes in doses from 2.5 milligrams all the way up to 15 milligrams weekly. Zepbound uses the same dosing range. The medication gets titrated slowly, meaning you start low and gradually increase to minimize side effects. Both medications are self-administered through a once-weekly injection using a pre-filled pen. Most people inject in their abdomen, thigh, or upper arm. The needles are thin, and most patients report the injections are relatively painless. Let's dive deeper into dosing because this is where many people get confused, and understanding this can make a huge difference in your experience. For semaglutide medications, Ozempic typically starts at 0.25 milligrams once weekly for the first 4 weeks. Then you increase to 0.5 milligrams for another 4 weeks. After that, you can go to 1 milligram and, if needed, up to 2 milligrams for diabetes management. Wegovy follows a similar titration schedule but goes higher. You start at 0.25 milligrams weekly for 4 weeks, then 0.5 milligrams for 4 weeks, then 1 milligram for 4 weeks, then 1.7 milligrams for 4 weeks, and finally the maintenance dose of 2.4 milligrams. This slow escalation is critical. Jumping to higher doses too quickly significantly increases your risk of severe nausea and other gastrointestinal side effects. Now, Tirzepatide has a different approach. Mounjaro and Zepbound start at 2.5 milligrams weekly for at least 4 weeks. Then you can increase to 5 milligrams. From there, you can go to 7.5 milligrams, then 10 milligrams, 12.5 milligrams, and finally 15 milligrams if needed. Here's the dosing mistake that sends 40% of patients back to their doctor within the first month. They try to push through severe side effects instead of staying at a lower dose that works. You don't have to reach the maximum dose. Many patients find their sweet spot at lower or middle doses where they get excellent results with minimal side effects. Some people do great on Wegovy at 1 milligram and never need to go higher. Others need the full 2.4 milligrams. Same with Tirzepatide. Your doctor should adjust based on your response, your tolerance, and your results. This is personalized medicine, not a one-size-fits-all protocol. So how do these medications actually cause weight loss? It's not magic, though it might feel that way for some people. First, they reduce appetite. Your brain receives stronger signals that you're satisfied with less food. Many patients describe feeling full after just a few bites, something they've never experienced before. Second, they slow gastric emptying. Food stays in your stomach longer, which extends that feeling of fullness between meals. Third, they appear to reduce food noise. That constant mental chatter about what to eat, when to eat, and cravings for specific foods. Many patients say this is the most life-changing effect. These medications work with your metabolism, not against it. They're not stimulants. They're not blocking nutrients. They're essentially restoring hormonal signals that may have become dysregulated over time. Now for the numbers everyone wants to know. Which medication produces better weight loss results? The answer might influence which one you ask your doctor about. Let me be direct. Head-to-head studies comparing Semaglutide and Tirzepatide show that Tirzepatide generally produces greater weight loss. In the Zepbound trials, patients on the highest dose of Tirzepatide lost an average of 20 to 22% of their body weight. Compare that to 15 to 17% with Semaglutide. For a 200-pound person, that's the difference between losing roughly 32 pounds versus 42 pounds on average. That's a meaningful difference. If you know someone who's been confused about these medications, share this video with them. Understanding the real differences could help them have a much better conversation with their doctor. However, and this is important, the best medication for you isn't just about average weight loss percentages. Some people respond better to Semaglutide. Others respond better to Tirzepatide. Factors like your specific health conditions, insurance coverage, and how you tolerate side effects all matter. Speaking of side effects, let's talk about the real experiences people have with these medications. What I'm about to share could save you weeks of discomfort. All 4 medications share similar side effect profiles. The most common are gastrointestinal, nausea, vomiting, diarrhea, and constipation, especially during dose escalation. Let me paint a realistic picture. Nausea often feels like mild morning sickness or car sickness. It's typically worse in the first few days after each injection. For some, it's manageable. For others, it can be severe enough to interfere with daily activities. Many patients report that foods they used to love become completely unappealing. Greasy foods, heavy meats, and rich desserts are common culprits. Some people can't even walk past a fast food restaurant without feeling queasy. Constipation is another big issue that doesn't get discussed enough. Because these medications slow digestion, you might go days without a bowel movement. The solution? More water, more fiber, and sometimes stool softeners. The flip side? Some experience diarrhea, especially after fatty meals. Your body might not process fats the way it used to. Here's what most doctors won't tell you up front. These side effects usually diminish after the first month as your body adjusts. More serious but rare side effects include pancreatitis, which presents as severe abdominal pain radiating to your back, and gallbladder problems, especially with rapid weight loss. Some patients experience hair thinning, though this is often related to nutritional deficiencies rather than the medication itself. These medications aren't recommended for people with personal or family history of medullary thyroid carcinoma or multiple endocrine neoplasia syndrome type 2. The key to minimizing side effects? Start low. Go slow with dose increases, eat smaller portions, avoid greasy foods, and stay well hydrated. Let's address the elephant in the room. These medications are expensive. Without insurance, you're looking at roughly $900 to $1,000 per month for Ozempic, around $1,300 for Wegovy, approximately $1,000 to $1,100 for Mounjaro, and similar pricing for Zepbound. But here's where it gets interesting. Your actual cost could be anywhere from $25 to over $1,000 per month, depending on your strategy. If you have type 2 diabetes, insurance is far more likely to cover Ozempic or Mounjaro because they're FDA approved for that condition. Most insurance plans cover these with copays ranging from $25 to $75 monthly. For weight loss without diabetes, that's trickier. You'll typically need Wegovy or Zepbound, and coverage varies dramatically. Some employer plans specifically exclude weight loss medications. Others cover them but require prior authorization proving you've tried diet and exercise first. Drop a comment below telling me your biggest question about cost or insurance coverage. I read every comment and I'll answer your specific situation. Here's the insider strategy. Both manufacturers offer significant savings programs. Novo Nordisk has a savings card for Ozempic and Wegovy that can reduce your cost to as low as $25